CNBC is looking at how countries around the world have tackled COVID-19. By talking to a wide range of experts, as well as everyday citizens, we're taking stock of what's gone well, and what hasn't. So far, there have been more than 10 million cases worldwide of COVID-19 and more than 500,000 people have died. The United States has reported more than 3 million cases and more than 130,000 deaths, the most of any country. Israel, the second country in our series, has confirmed more than 33,000 cases and more than 300 deaths. See also, how Canada is fighting COVID-19, ramping up PPE production, travel ban from the US, and Bonnie HenryMany of experts have separated Israel's response into two buckets, February to May, and May to now. Some are calling it the first and second wave of the virus. By mid-April, the country of 8 million was ready to declare that it had succeeded in the fight against COVID-19, and had begun reopening schools, bars and restaurants. Prime Minister Benjamin Netanyahu noted in press conferences at the time that the country had done an admirable job in safeguarding life and blocking the outbreak of the pandemic with its aggressive response. The mood in Israel was highly optimistic. But that wasn't the end of the story. The country is now seeing a 50-fold increase in new cases and is starting to shut down pubs, pools and gyms once again. The government is now wondering whether Israel reopened too soon. Still, a lot went right in Israel in the first phase of the pandemic that other countries can learn from. One of the major reasons that Israel was largely able to fend off COVID-19 over the spring and early summer, they say, is that politicians deferred to public health experts to formulate a plan, and they stuck to it. There were early lockdowns across the country, and a decision to bar all flights from China in late January. A month ago, I remember jokingly saying to a friend in another country, "Warm regards from the other side of the curve," said Yonatan Adiri, founder and CEO of an Israel-based health tech company. But it didn't last. Israel's health system provides universal coverage to citizens and permanent residents. And Israelis choose from 4 competing non-profit health insurers that provide a benefits package. The country also collects medical information in a centralized manner, and the 4 insurers use the same technology. That made it easier for Israel's public health officials to conduct biosurveillance and contact those at risk than it was in some other countries, like the US, where medical information is scattered across health systems. We created a predictive model for those likely to suffer from the virus, and in early March, we sent SMS messages and followed up with personal phone calls from physicians to everyone at risk for the higher tier of COVID-19 complications, said Dr.